Even with the vaccine being shipped to the masses, testing remains a critical tool in the COVID fight.
But tonight, local doctors face a difficult choice, turning down testing for patients or just losing money over and over again. Only News 4 investigator Lauren Traeger is looking into one major insurance company's practices.
At A to Z Pediatrics in the Metro East,
I won't fix your brain, I promise.
drive up COVID tests for dozens of sick kids every single day.
Insurance companies should be making it easier for medical professionals to do what we need to do right now to save everyone else from the pandemic.
But instead, Dr. Jean Wagner says one insurance company hasn't been playing fair.
I am really upset. I'm upset for my patients. I'm upset for my families, my staff. You know, I should not have to be this stressed right now about something that small.
She says one COVID test cost them $34.38. That doesn't include the cost of PPE or staff time to administer it. Like every doctor's office everywhere, they then submit bills to the patient's insurance, expecting reimbursement.
Every other insurance company, including Illinois Medicaid and TRICARE, which is what the military uses, is paying us $51.31 for every test that we do.
But Wagner says there's only one exception, United Healthcare.
When we were getting our bills back from UHC, we were only getting $30.59 for every test.
Meaning on every single COVID test they give, they're actually losing money.
So we eat it, yeah.
A difference of only about $4, but Wagner says at a small practice like theirs, the lost revenue is adding up by the thousands.
We're not looking to make a profit. We just need to get the cost covered of every test so that we don't lose money.
When we get paid less than what I even pay for a test, that's quite a big hit. I mean, it's every dollar counts.
Dr. Congas, who has practices on both sides of the river, says he too is feeling the pinch.
I'm sure they're looking for any way they can to save a dollar, and it just affects the little guy like me the most.
While most insurance plans, he says, are reimbursing full cost of the test and then some for supplies and staff, UHC is not. An article in the New York Times earlier this month also detailed accounts from doctors all over the country dealing with the same issue.
We spend hours on hold and switch to different people, and they say someone's going to call back. And, it's not much of a response.
Both local doctors say they have gotten few answers from the insurance company. Dr. Wagner says she was told simply to tell her patients to go elsewhere.
Which we found completely unacceptable to us and to our patients. That all that's doing is putting up a barrier between my kid and getting back to school or to sports or with their family or whatever it is they need to do.
Federal coronavirus regulations prohibit the doctors from passing on those extra costs to their patients, something they say they don't want to do anyway. So one doctor in our area told us because of the situation, they just simply stopped offering COVID tests altogether for patients carrying United Healthcare insurance cards.
Bottom line, what do you want to see United Healthcare do?
I just want to see them adapt more quickly when there are, in a situation like this, when there are new codes that come out. Talk to the providers, see how much those tests cost, see what the overhead involved is, and help us pay our bills.
News 4 put in a request to speak with a representative from United Healthcare on camera. Instead, we received a statement from a spokesperson saying, quote, the rates we pay for rapid COVID tests follow applicable requirements of the CARES Act and what others in the market are paying, with average rates in the $40 to $50 range. When paying new codes, including those created for the testing or treatment of COVID, we honor our provider contracts, which generally refer to industry sources to set an appropriate market price.
Of the cost of a test for a disease that didn't exist, for a test that wasn't invented. And somehow we were supposed to know to negotiate for those costs.
Wagner, though, says their contract is from 2008 and says UHC has been unwilling to renegotiate. Still, in their statement, UHC went on to say, quote, of course, we work hard to make sure every member has access to testing. We encourage any providers with payment questions to contact us.
We don't have time or energy to push and fight back.
But these doctors, overwhelmed with treating sick patients, say they just want United Healthcare to live up to its name and work with them to fight COVID.
We think we're going to be testing kids like this for the next 2 years, maybe more, that's going to really add up over time.
A spokesperson for UHC said they would reach out to those doctors directly now. United Healthcare has reported an increase in profits, earning $15.4 billion in profit in 2020 versus $13.8 billion in 2019. Have an issue you want us to dig into? You can email me at investigates@KMOV.com. I'm Lauren Traeger, News 4 Investigates.